So at Physiofunction, we work with the LiteGait system. This is a mobile partial bodyweight system that allows people to walk over ground and also over a treadmill whilst fully supported and preventing them from being able to fall over. So it works by having an overhead gantry within a fixed harness, so the patient is fixed into it either from a seated position or from standing and holding onto handles if they're able. And then once their body weight is supported, they are fully safe within the machine and unable to fall over. So it allows us to get patients on their feet, working their muscles, but feeling safe and controlled in the environment. And we can use this with any patient who's got the ability to take some weight through their legs. We don't want to be hoisting somebody up onto their feet and dangling them in the air, but if they have the ability to bear some of their body weight, we can absorb some of it through the machine and then allow them to work on their balance, work on their mobility, and work on their cardiovascular fitness. One of the big benefits of it is that it takes away the need to stabilize. So a lot of patients get onto their feet and they're very tense, they're holding on very tight with their arms, so it really affects their posture, really prevents them from being able to stand upright, use their core, use their glutes effectively. So with the harness system, they can relax a little bit more into the system and they can work on their posture, work on their stability, and then we can gradually release their body weight support as they get more and more confident. So with the LiteGait, we're able to get people walking earlier and for longer distances without fatigue because they're not having to use their whole body weight. Now this will give us benefits to their fitness, it will give us benefits to their walking because we can work on their technique without having to worry about them losing the balance and falling over. One of the really nice features of it is that we can put it over the top of the treadmill, so we can have a very, very small area to work in. A therapist can be very, very close to the patient and providing hands-on support to them to help them move effectively. So it works really, really nicely to just re-educate the movement patterns, get the foot striking in the right way, get them carrying their body weight through correctly, and that will then link through into their walking over ground. So we use the LiteGait with a wide range of patients, whether it's cerebral palsy, MS, brain injuries, stroke, incomplete spinal cord injury or Parkinson's. Any condition where the individual can stand under their own volition to a degree, we can utilise the LiteGait. So at Physiofunction we work with the GMove. Now the GMove is a wearable compression suit that we use on the legs. It provides varying degrees of compression to have different effects upon the body to try and aid mobility and aid exercise. So at low levels of compression, it takes in the sensory fibres within the legs and it helps improve the person's awareness of where their leg is and where their balance is. So we use it to try and help them restore their centre of gravity and help them just take steps with more feedback coming up from the feet. As we increase the levels of compression, they get more and more effect upon their muscles, so it draws in the fascia that surrounds the muscles and gives them a greater propensity to contract. So when those muscles work, greater effects happen at the joint, so it's easier for the individual to take steps or to move sideways or to even do bed-based exercises such as a bridge or a leg raise. So the GMove Suit involves a compression unit which the individual will wear on their front and then two cuffs that run down each leg, two compartments in each, one in the thigh and one in the calf, and it measures in millimeters of mercury the amount of pressure that's delivered through each compartment. We can set a single point of compression for either leg, so the point that we want to use is optimal for both sides, and then it remains either on constantly for the entirety of the therapy to give them that support and that feedback throughout, or it will go intermittently to provide a more massaging type effect or a warm-up type motion for the individual that we often use when they're in bed. So the GMove can have really, really nice improvements in the individual's balance. It gives them a physical benefit when they've got the suit on, so they feel more stable on their feet, they get more feedback through, and we often see that this carries over when they take the device off so that they feel more grounded, they feel more aware of their control and stability and feel more confident on their feet. We can also see really nice improvements in blood pressure, so it supports more structure to the veins and the arteries down in the legs, so when people go from a seated to an upright position or even a laying to a seated position, it can offset the blood pressure drop that can be seen in a lot of our patients. We can also see positive effects on swelling and lymphatic effects in the legs, so where people get a lot of pooling in their ankles and get a lot of swelling in the lower leg, the GMove can be really effective in helping to recirculate that back up into the body system, allowing more range of motion, more control, more sensation coming down through the feet. So predominantly we use the GMove with patients who are able to walk. However, it can be used in bed in a supine position, so I will work with patients doing bed-based exercises, trying to give them more feedback through their legs so they can get a better sense of what their muscles are doing, how well their muscles are working, to then try and transition into more loaded positions. So generally speaking, it will be applied to those people who can stand and they can walk for a short period of time, but equally we can apply it to more able patients and turn the pressures up and have them exercising harder, which gives us the ability to work in what's called blood flow restriction conditions, where we're making the harder muscle fibers work with less load. So we're not getting people as tired, but we're still giving them a really, really heavy training session to give them greater strength change.